You are watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. David Greenlee. We've invited Dr. Greenlee on the program today to discuss who's a candidate for dental implants. Dr. Greenlee, welcome to the program.
Hello, Randy. Thank you for inviting me.
Now, before we get into today's topic, tell us a little bit about your practice.
Well, I've practiced in Raleigh. I've practiced there for 20 years. I have a general practice, provide all phases of dentistry. I see patients from 2 years old to 102.
Okay.
And I'm very privileged to work with a wonderful staff. It's a very dedicated and caring group of individuals. And we've got a wonderful family of patients. Really enjoy going to work. Feels like I'm seeing old friends almost every
Is that
day.
right?
So, yeah,
Old
it's really
friends.
nice.
Now, dental implants. We've invited you on the program today to discuss this topic. How long have you been doing dental implants?
Well, I've been involved with dental implants really for the entire 20 years. The office or the practice I took over for, Dr. Richard Hunter, was placing dental implants. So I have been working with dental implants really for 20 years. Over the years, they've become an increasingly big part of our practice and become really a very routine part of dentistry today.
So who's a candidate for dental implants?
Well, really anyone that's missing a tooth, from a single tooth to maybe they've worn dentures for 20 years. Anyone with a missing tooth could be a candidate.
Okay, now you both place the implant or do the surgery.
Correct.
And also put the cap or crown on top. Is that right? Tell me about that process.
Well, there's sort of the two phases. The first is involved with putting the implant in the bone, so that it becomes fused to the jawbone, becomes part of the jawbone. That's the first phase, and then the second phase is putting the tooth on it. And depending on the needs or the circumstances of the patient, that may be a single tooth, or it may be several teeth, or it may be the entire arch of teeth.
Okay, now anticipating this interview, I understand that's not how it's always done. Normally there's two people involved.
Well, typically, a surgeon of some sort, a periodontist or an oral surgeon, would typically place the dental implant, and then another dentist, the restorative dentist, would provide the teeth that go on.
Okay.
So it has in the past traditionally been a two-step process.
So you've had specialized training in placing the implant?
Yes, absolutely. I've studied at the Misch Implant Institute, which is under the leadership of a dentist named Dr. Carl Misch, who is probably the leading expert in dental implants throughout the world. And I've studied extensively there. So
this is your focus, though, dental implants, of all the areas of dentistry.
Correct.
Is that right?
Well, we provide a comprehensive services of dentistry, and implants is becoming an increasingly large part of that.
Okay, now how big of a problem, by the way? Because I guess denture wearers are the ideal candidates for dental implants. But how big of a problem is this?
Well, it's huge. If you're wearing a denture and you're uncomfortable with that denture, the denture slides, moves around, you're not confident in that, it has all kinds of implications for your daily life. Just going out to eat with friends is something that you're intimidated about or very uncomfortable about. So if you're not able to eat, think about all the activities, all the family gatherings, the things that we do in our daily lives. Food is involved, and so if you're unsecure about just sitting down and eating in front of other people, that's a huge problem.
Okay, now you don't need a lot of dental implants, I guess, to give somebody a, for the denture wear.
It varies on the situation, but a lot of times even 2 implants can make a big difference.
To secure a denture?
We like to have more. There's more stability, but it can be done with 2. And the idea there is you use dental implants to anchor that denture in some way so that when you put that denture in, it literally snaps onto those implants and is held securely in the mouth. No more sliding around, no more problems.
Now, we've talked a little bit on the phone prior to this interview, and you said that if the denture wearer knew what they were missing with dental implants, that they would all do it.
Oh, yeah.
I mean, is that accurate?
Oh, without a doubt. The problem is with the denture wear, a lot of times a patient gets into that position, they're for whatever reason have come to this point in their dental health, and that becomes only the real option that they've had. Now that may have been 5 years ago, may have been 30 years ago, but once you have the denture, your ability to chew is dramatically decreased the day you have dentures. It's about 25% of the ability to chew with natural teeth. And then over the years, you start to have a even less ability to chew because your jawbone is sort of slowly melting away. And those dentures are sort of going down into the bone, and you
So the bone goes away.
The bone is melting away. That is true.
Just because there's no pressure of the teeth on there?
Well,
why is that?
Because the teeth are not there. The teeth or the bone is there to anchor the teeth. And so once the teeth are gone, there's no function for the bone. There's no purpose for the bone.
Okay.
And so the body just starts to slowly resorb that away. And that's a continual process.
I see that sunk-in look, by the way, with denture wearers. That's where I feel like I could spot them.
Exactly. And that's very true. And that's something that happens. It gets worse over time. As that jawbone's melting away, those dentures are settling in. And as that patient bites together, the nose and the chin start getting closer together.
Interesting.
And that's how you get this sort of the elderly look, premature aging, a lot more wrinkles around the lip and mouth area.
So implants have become very popular nationwide. I mean, is this the new so-called gold standard, if you will, when somebody's missing a tooth?
I would say it's definitely the treatment of choice when you're missing a tooth. It's really, it gives you your tooth back.
Okay.
It puts a tooth back. So instead of going with some other remedy that is a compromise, you're able to go back where you actually have your tooth back again. It's fantastic.
What are the different categories of patients you're seeing in your practice for dental implants?
Really anyone that's missing a tooth.
Okay.
That could be a single tooth, someone that's maybe born without the tooth or lost the tooth for whatever reason, to someone that's missing several teeth, to someone who's maybe been to the dentist and has been told that they're going to lose all their teeth and that they're facing dentures. So in that case, the implants become a good option. Also the patient that's worn dentures, maybe for whatever number of years, dental implants can still be a very good solution for them.
Can you be too old for dental implants?
I don't think so.
Is that right?
I recently placed an implant on a woman that's 91.
Now, why would a 91-year-old want to get a dental implant?
Well, she wants to chew. She wants a life, and
okay.
It was visible. She was not going to tolerate a missing space, and even though she's 91, she's still very active, very healthy, and has several years ahead of her.
Now, how does she hear about you? She was already a patient?
Regular patient.
Okay.
She was one of our patients who, just in the course of things, the old dentistry broke down.
So nowadays, if you're missing a tooth, is it a standard where each patient is supposed to be offered a dental implant as an option?
I would certainly say so. It is certainly one of the options, and that's what
because
I
I've
like
met people going into this interview that say, I was never told about dental implants.
Well, I would hope that's not happening anymore.
Okay.
I think it should be the case. It should be certainly one of the options that's offered to patients. My point of view is if you are faced with possibly losing a tooth, you need to be informed of the variety of things that can be done.
Okay.
And so we like to lay out a variety of choices for the patient and help them to choose what's right for them.
So it's not just all about implants if I go to your office?
Oh, certainly not.
Okay.
It's one of the various dental procedures that we offer.
Now, going into this interview, driving over, I'm talking to my mother. She's 74 years old. And I told her I was interviewing you. And she has been wearing dentures since she was 28 years old. And she says, I'm way too old.
No.
And too unhealthy for dental implants.
No. And you said 74?
74.
And that is one of the things that I see a lot of is that's a very, very typical situation. Someone that maybe is in their 70s, they start thinking, I'm too old for this. Why should I?
They self-diagnose.
Well, and they don't want to. They think they shouldn't invest the time and energy and money into getting this situation taken care of. The problem is that when I see that happen, then that patient, we see them over the years, 5, 10 years go by. Now they're in their 80s.
Okay.
Their problem's gotten worse, and they're suffering more and more with it. The dentures that they've been wearing are fitting worse. They're having more and more trouble trying to chew and talk, and just wearing the denture is uncomfortable.
Is that a big problem? Because I know a few people with dentures. I don't hear that they're complaining about that they're loose or falling out when they're laughing, things like that.
One thing.
Are these the things they tell you?
Yes, it takes a little while. It has to be brought out a little bit. They don't like to sort of dwell on those sorts of things. But one of the things, if you're watching television, look at how many denture adhesive ads you're going to see. They're everywhere. That means there's a problem. They wouldn't be selling all this polygrip if there weren't loose dentures out there.
Yeah. So they're becoming loose. So I get this, understand this correctly, because the bone is going away or resorbing.
Bone is resorbing, correct.
Okay.
And so that's a very slow, gradual process. The denture slowly starts to sort of loosen up, and it's something that happens so gradually that a lot of times the patient becomes used to it. They forget sort of really what it was like to chew. They forget how much of a disability they have.
Then why isn't everyone getting dental implants? Is it just the expense they're worried about?
Well, I don't know. I think it's an excellent choice, and from what I've seen, anytime a patient has become aware of the benefit of the dental implant, they'll look at that and say, that is definitely the best way to go.
I mean, in the long run, I mean, with everything that you guys do, the dentist, I'm sorry, respectfully, to save a tooth, seems like giving somebody their tooth back with a dental implant is a lot less expensive.
And
I mean, is that true?
In the long run, that is very true. The reason for that is that even once you have a single crown on a tooth, that's not the only investment. That crown is the initial investment, but when you look at the cost of the dentistry to upkeep that crown over the course of one's life, it becomes huge and actually far more expensive than a dental implant.